So imagine this scenario. You're in a process group, maybe you're new to group therapy, and you have an idea of some of the facilitation techniques you're going to use. But before you can get a word in edgeways to start the group, Jimmy raises his hand and says,
I'd like to start, please. I would like to, read you all a short story I wrote last night.
the group shifts awkwardly in their seat because they know, and you know, that this isn't show and tell. And you're also not entirely sure if this short story is actually going to be that short, judging by the enormous wad of paper Jimmy has just pulled out of his bag. He looks at you and the group with some pleading in his eyes, and you know that this is important to him. What are you going to do? This is a bit of a true story. I changed things up a bit, obviously, so that no one is recognizable, but this pretty much happened to me, and it was quite a painful moment because I knew the group had things that they really wanted to talk about. The last session was really intense. There was some conflict to resolve, and a short story was going to be a serious diversion from what the group actually needed. The other thing that I knew was that Jimmy loved to talk. He really enjoyed the spotlight and would gladly talk for 90 minutes if I let him. So before I tell you how I handled it, let me back up and tell you who I am and what the hell I'm doing talking about group therapy. I'm Oliver, and I'm a psychotherapist here in Los Angeles, and I'm also a group certified psychotherapist, which means that I have some extra letters after my name, and you can have those extra letters too if you sign up for some additional training and supervision from AGPA, that's the American Group Psychotherapy Association, who are not sponsoring me, but really should be. This is the second group therapy video, and if you missed the first one, you might want to go back because I'm going to be talking about the group agreement in a bit, which is the first tool that I shared in that video. But in this video, I'm going to give you 3 or 4 awesome group therapy facilitation techniques that come from modern group analysis. It's a theory of technique that I have found to be extremely useful and powerful and easy to learn. If you want more group therapy videos, let me know in the comments. I occasionally moonlight as a group therapy professor at Antioch University, so I have 8 more lectures that I can turn into videos for you if you're interested. So hit subscribe and leave me a comment and I can make that happen, but I need to know that somebody's going to watch them. Let me give you a very brief recap from the last video just to jog your memory. We decided that what makes a process group a little bit different from, say, an AA meeting, which is also a group, or a parenting skills class, also a group, is the amount of emotional processing that goes on. We decided that a process group consists of 6 to 8 people who are, in general, looking to enhance and improve relationships with themselves and others in order to have a more satisfying and fulfilling life. Ideally, in a process group, we want people to be talking about their feelings as they come up in the moment, and especially the feelings that are directed at me as the group leader or other members of the group, because that's how we're going to learn how to enhance and improve relationships with ourselves and others. We also decided that if you put 6 to 8 people in a room for 90 minutes, none of this will probably happen. We just don't do that naturally, and we need some help. I mean, if we could do all of that, we obviously wouldn't be. The first tool we put into place was the group agreement, which is going to help us nudge people talking about their feelings and exploring their reactions to other people. We are not putting the agreement in place because we're setting rules and demands, but because we can use them to understand what blocks people from talking about their feelings and sharing what's going on. My favorite parts of the group agreement that are going to be super important in this video is the agreement that we make to turn our thoughts and feelings into words and not actions, and the agreement that we make to allow other members to affect us and be willing to talk openly and honestly about our reactions as we become aware of. Do people do this naturally? No. Do they do it in individual therapy? Nope. So our job as group leaders and facilitators is to help them do this and also help them understand why they can't. Why on earth do we want people to turn their thoughts and feelings into words? Well, what we're really talking about there is the consequences of unexpressed feelings. If you don't know how you feel about someone, how can you feel close to them? How do they know that you care about them if you don't know what you're feeling and you're not talking about them? Intimacy and connection are a vital part of this. And if you don't know how you feel, you're really saying you don't know yourself. So in a bit of an abstract way, when we don't know how we feel, we've got some identity issues or perhaps an underdeveloped sense of self. Similarly, if you don't know how you feel when good things are happening, how do you feel good about yourself generally? That's
How
self-esteem, right? If you don't know how you feel and there's this big storm of emotional grossness in you, how are you going to get rid of it? Well,
do
I might act out. I might slam doors and yell at people instead of telling them I'm angry. I might also go and eat a lot of chocolate because that makes all of my feelings go away sometimes, usually, if there's enough. But I might also go and drink or use drugs. So we're talking about addiction and substance use. What gets in the way of us talking about our feelings? Well, all kinds of things. The way that we were raised, our family of origin, and the rules our family had about what feelings were acceptable and which weren't. Societal rules like boys don't cry and girls don't get angry. Fear and anxiety. We don't want to be vulnerable because that's just damn scary. And when we don't know what we feel, we're more likely to avoid it. Think about this from an evolutionary perspective. In the past, when we were hunter-gatherers and we stumbled across a big scary monster with sharp teeth for the first time, we'd avoid it because we didn't know what the hell it was and, well, it might be dangerous and it might eat us. Today, in the 2020s, that same tendency, and we call it experiential avoidance. If we don't know what something is and we're not sure what's going to happen, we're much more likely to avoid it. That's why we don't open those dodgy looking letters from our bank. So as group facilitators in a process group, we have some challenges because what we want isn't going to happen naturally. Fortunately, modern group analysis has some nifty ideas for us. The theory makes a point of having clients clarify and express their feelings. And if we're working from this orientation, we're going to understand that upon entry to treatment or the group, clients do not have access to a full range of their feelings. We're going to assume, in fact, that feelings in our clients are likely to be dissociated, avoided, disguised, or enacted. And if we assume this to be true, then all behaviors, conscious and unconscious, have an element of emotional communication to them. I say this to parents a lot when we're talking about their kids. Every behavior is a communication. Slamming doors might be communicating someone is feeling angry. Crying might indicate someone's sad. Now, in a group, it's our job to be the good mummy and daddy and decode these communications, preferably with the help of the group. Our interventions, what we say in the moment, are aimed at developing an interest in our clients' feelings and to invite the expression of those feelings in words. So the group agreement we made helps remind group members that they agreed to say what they feel over actions and acting out. Now, implicit in that, and just between us therapists, is that we are trying to get them to use their words to describe feelings and explore when they're using defenses to cover up those feelings, like humor or projection. I can guarantee that you will absolutely run into this in group or any therapy situation, really, in which you ask someone what they are feeling and they give you a thought. I'm so sorry I'm a little late to group today, guys. I'm wondering if anybody has any feelings about me being late. I can understand traffic was really bad. Feeling or thought? I knew you would be late. You're always late. Feeling or thought? These interventions that we're going to be talking about are getting people clear on what's a thought and what's a feeling. So I'm a big fan of Bowen's theory of differentiation. And that's the idea that the epitome of psychological health is when we can separate out our thoughts, feelings, self, and other. So this whole point of getting clients to tell you a feeling and not a thought is even more important when you realize that what you're trying to do is help them to differentiate their thoughts from their feelings. I find it helpful to operate under the assumption that group members have a feeling about their self, and sometimes they will also have feelings that extend towards another person. So there are also interventions that are pulling out feelings that go towards the other and feelings that focus on their self. And when we do interventions about this, it's about separating self from other. Also part of differentiation. When a client says, I feel really hurt and I feel really hurt that I got dumped, that's great. And you can think about what a modern group analyst would do, which would be to help a client express and clarify all the feelings. So I might say, I can really see that you're hurt by that relationship ending. I'm curious if you have any feelings that go towards your ex. Yeah, I suppose I do. I guess I'm really angry. Actually, the more I think about it, that guy's a dick. So going back to Bowen or differentiation, the interventions that we're talking about here are about pulling out the feelings that go towards the other person, and helping us distinguish feelings that are about ourselves. So I feel hurt that I got dumped, but I'm also having feelings of anger towards the other person. So let's go back to Jimmy wanting to read his goddamn short story in my process group. Kidding. Love you, Jimmy. In my mind, I'm remembering that the group agreement says we're going to turn thoughts and feelings into words and not actions. And I see reading a short story as being an action, right? That's a thing that he is doing. And remember, behind every action, there's an emotional communication that needs to be made conscious and preferably verbalized to group members. I could, in theory, remind him about the agreement, but that's just a little sort of on the nose. So I might be more likely to say, Jimmy, I'm curious about what feelings you are having behind wanting to read this short story to the group. Now, Jimmy is not going to tell me a feeling at that point, trust me. He's going to say something like,
I don't know. I just really, really want to read it.
it sounds like there's some urgency behind you wanting to read it. Could that be a clue as to what the feeling is? That's an intervention there that is helping Jimmy realize that there is a feeling motivating his desire to read his short story, which is good progress already, because he's becoming aware of something else other than this desire to read. So Jimmy might say,
Oh, well, I think I'll just feel better after I read it.
okay, great, Jimmy. You are thinking that you will feel better when you read this. But what are you feeling right now?
Oh, I guess I just feel kind of weird about this now that you're making such a big deal out of it.
Jimmy's still not giving me a feeling. He says he thinks he'll feel better when he does read it. And then he says he feels weird. You're probably already aware that clients will often respond to a feelings question with a thought or a state of mind. Weird, confused, or I feel empathy are all states of mind and more about thinking. Depending on my relationship with Jimmy, I might leave it there, or I might use another intervention that will help him separate out his thoughts from his feelings. And that is to deepen the reflective function to help differentiate out thoughts from feelings. For the sake of this video and demonstrating things, I'll beat Jimmy up some more and clarify and deepen what's going on. I'm not sure about weird, Jimmy. It's a bit too general for me, and I can't really tell if it's a thought or a feeling. Could you be a bit more specific about how you're feeling?
Well, I feel nervous now. Can I just read it and get this over with already?
I get that. And I'm going to ask the group in a minute, Jimmy, if they're okay with you reading your story to them. But I've got this idea that what might make them more agreeable to listen to it and what might help you in asking them is if you're able to share with us the wish or the desire behind wanting to read it. I really want Jimmy to engage his observing ego. That's the part of us that goes, wait a minute, what is going on with me? What am I feeling? Why is this therapist being so weird? Asking someone about the wish or the desire or the fantasy is a great way to do this.
I just want the group to get to know me better and to maybe understand how bad my depression was before I got here. Maybe I want them to know me more.
Good job, Jimmy. Thank you. Correct me if I'm wrong, Jimmy, but I think group, he's telling you that he's got a desire and a longing to get to know you or for you to get to know him. And I think that there is a wish underneath that to feel more connected to you. Or does anyone have thoughts or feelings or reactions to that? In that exchange, I'm really getting into self and other. And I could have belabored the point even more and got him to be very clear on his feelings of wanting to be understood or closer to the group. But I also want to turn it back to the group quite quickly, knowing that he's already taken up a big chunk of time and now he wants to read a story. But point is that roughly that we got into self and other as well as thoughts and feelings. Had I just let Jimmy read that story, we would have never got to this point where Jimmy is actually revealing that he wants to feel closer to people and he wants to feel more connected to the group. Reading the story might have done that, sure. But my job as a therapist, I think, is to verbalize that wish, verbalize all of the feelings underneath it, and help Jimmy really say out loud, I want to feel closer to you guys. That's the progressive emotional communication that we're looking for in group therapy. We want people to be saying, I want to feel closer to you, rather than just wishing it or acting out on it. So let's recap. And hopefully, this is going to be a very helpful framework for you to think about how to get your clients to talk more about their feelings. And in group, this is particularly important because it's all about connection. Number one was action into words. Rather than let someone perform an action, I'm going to try and get them to turn things into words. That's what they agreed to do, but they're not going to do it just because they said so. Thoughts and feelings. I am going to try and get clients to avoid giving me thoughts when I want them to give me feelings. And I'm a bit of a pit bull for this. I will be very insistent that we talk about our feelings right from the first group. I've got feelings wheels all over my office. There's no excuse. Number three was clarify and deepen. So I will push clients to go deeper to reflect on wishes or fantasies. And that's just one way of getting people to understand that there are feelings behind what they're saying or doing. Number four was about self and others. So you want clients to talk about feelings that go towards the group or you as a leader or you as a therapist or the group as a whole, as well as the feelings that they have in themselves. Right, so let me know if this was helpful. If you want more ideas on group therapy techniques, I will try and tidy up my slides for you and get those to you on a PDF. If you need them, drop me a comment, hit subscribe, share this with a friend. All of those things would be really helpful, and let me know that you want more of these videos.